Hello everyone, I am Anita Rai Limbu, Master in Pediatric Nursing. Today I am going to present on the topic that is bronchial asthma, which is one of the most important topic related to respiratory system. This is my personal YouTube account. Please do like, share and subscribe my channel to support me, and I will try my best to bring important content in upcoming days. And it will be my great honor if you will give feedback, as I am new in this YouTube field, which will help me to improve my content. Thank you. First of all, have a look that we are going to discuss. We will discuss about what is bronchial tubes and its function in short, which will make the topic to understand a little bit easy. Then we will define bronchial asthma, its types, classification, indication, potential causes. Then we will discuss in brief about pathophysiology. After that, clinical features, diagnosis and how to assess the severity of asthma, management, finally prevention. So, what is bronchial tube? When we breathe in air through the mouth and nose, that air goes to the trachea, which is also known as windpipe. The trachea is now divided into two tubes, which passes to the left and right side of the lungs. That tube is known as bronchial tube, which helps the air to pass from trachea to the both lungs. That bronchial tubes are divided into branches of other small tubes, which are called bronchioles, and sometimes it is termed as bronchi or airways. So, people with bronchial asthma have inflamed bronchial tubes. That means the airway gets swollen and produce lots of thick mucus. And the bronchial tubes are so much sensitive or hyperreactive to certain things like exercise, dust or cigarette smoke, which causes allergy. This causes the muscle around the bronchial tube to tighten up. Therefore, combination of inflamed and muscle tightening narrows the airway and makes it difficult to breathe in. Now, have a look on definition. Bronchial asthma is a chronic inflammatory disease of the respiratory tract, which is characterized by bronchial hyperreactivity and respiratory obstruction. That means bronchial asthma is a chronic inflammatory disease which is characterized by airway obstruction, airway inflammation, and also increased responsiveness of trachea and bronchi to various stimuli due to the bronchospasm. Mucosal edema and thick secretion causes temporary narrowing of the bronchi and lead to dyspnea. So, to make it more clear about bronchial asthma, let's have a look on the picture. Here in the picture, you can see the normal lungs and asthmatic lungs. In the left side of the picture, the airways muscle is relaxed. The lining is normal as well as amount of mucus is normal. So, this is the normal airway. On the other hand side of the picture, you can see the muscle of the airway is tightened. The lining is swollen and mucus is excess present in the airway. These symptoms indicate the asthmatic lungs. Let's have a look on next slide. So in the next slide, there are types of asthma. There are 6 types of asthma. So first one is extrinsic asthma. Second one is intrinsic asthma. Third one is mixed asthma. Fourth one is exercise-induced asthma. Fifth one is aspirin-induced asthma. And last one is occupational asthma. So totally there are 6 types of asthma. Now let's discuss about the extrinsic asthma. So it is also known as allergic asthma. It occurs when the immune system overreacts to a harmless substance that may be pollens or dust that is inhaled. The body releases an antibody called immunoglobulin E. The release of this antibody leads to inflammation and leads to symptoms of asthma. So, in the children with Extreme asthma have a positive skin test to offending allergy and positive family history for asthma. Now, next one is intrinsic asthma. So, it is also known as non-allergic asthma. It refers to some manifestations of airway obstruction, but its causes are unidentified or non-specific factor in the environment. This types of asthma is non-immunoglobulin mediated. It may be caused by change in temperature, viral respiratory infection, and emotional stress or excitement. So, next one is mixed asthma. In the mixed asthma, that is, there will be the combination of both, that is intrinsic as well as extrinsic asthma. That means the characteristics of both intrinsic and extrinsic will be there present in the mixed asthma. Now, let's have a look what is exercise induced asthma. So, let's know what causes the exercise to induce asthma. During our normal breathing, the air which we breathe in from nose is warmed and moist by the nasal passage and then goes to the lungs by passing through the trachea and bronchioles. But during the period of exercise, we need more amount of air to breathe in to fulfill the demand of body. So we start to breathe in through mouth and we inhale cold and dry air. The muscle which is band around the airways are sensitive to these kinds of changes in temperature and humidity, that is cold and moist air. So, due to these kind of changes, the muscle which is band around the airways gets constricted, which narrows the airway, and due to narrow, we cannot breathe properly and result into exercise-induced asthma. So, in this way, exercise-induced asthma can be caused. And last one is aspirin-induced asthma. It is a medical condition where asthma symptoms can develop after we take aspirin and related component or non-steroidal anti-inflammatory drugs. When medicine is taken that blocks the cyclooxygen 1 enzyme production of thromboxane that decreases the anti-inflammatory prostaglandins, due to which there is overproduction of inflammatory leukotrienes, which tend to cause severe exacerbation of asthma and allergy-like symptoms, though the underlying causes of disorder is not fully understood yet. Now, next slide is about classification of asthma. So, bronchial asthma is classified into 4 categories, that are severe persistent, moderate persistent, mild persistent, and intermediate persistent. So, it is classified according to the symptoms seen at daytime and at night times, as well as peak flow rate. So, in the severe persistent, there will be continuous limited physical activities present in the day times, and in the night times the symptoms will be frequent and its peak flow rate will be less than 60% predicted, as well as variability will be more than 30%. Now, in the moderate persistent, there will be daily attack, activity and sleep at the daytime, and in the night time it will be more than one time a week. So, its peak flow rate will be 60 to 80% predicted and variability will be more than 30%. Now, in the mid persistent, the symptoms will be more than one time a week, but it will be less than one time a day. And at the night time, the symptoms will be more than 2 times a month, and the peak flow rate will be more or equal to 80% predicted and variability will be 20 to 30%. So, in the intermediate, there will be less than one time a week and it will be asymptomatic and normal. Peak expiratory flow rate attack at the daytimes. So, at the night times, the symptoms will be not more than 2 times a month, as well as its peak flow rate will be not less than 80% is predicted, and its variability will be less than 20%. So, in this way, we can classify according to the symptoms which are present at the daytime, at the night times, as well as with its peak flow rate. Now, let's discuss about incidence. So, most cases have origin in the first 2 years of life and its peak incidence is seen in 5 to 10 years of ages, and boys suffer twice as much as girls. That means here you can see boys suffers more than the girls. So, its incidence rate is more than the girls rate. So, let's have a look what are the potential causes for asthma. So, first one is family history. So, for having asthma, it is the first must cause. As we know that if the family history is not good, that means if they are poor means they have to work in like a dusty environment or polluted environment, as well as they don't have good food to eat. So they have to work in that types of places. So working in that types of environment that may lead to asthma, as well as due to lack of nutrition they may lead to asthma. Another one is allergy. So those people who are more exposure or chronic exposure to airway irritants, that means their airway may be inflamed and due to which they may have asthma. Next one is lack of breastfeeding. So to those children, those who don't have a breastfeed and they have artificial feeding, means they don't have good nutrition. So lack of the nutrition, then they don't have ability to fight against the disease condition. That means their immunity will be weak. So due to lack of immunity power, the baby will not be able to fight against the disease condition and they may have the asthma. So another one is low socioeconomic status. So due to the low economic status, they are not able to buy a proper nutritional diet or nutritional food to eat. So due to that, they may suffer from the asthma, as well as they have to work in such a dirty or polluted area also sometimes get money for their living. So that's why they may suffer from the asthma. Another one is passive tobacco or smoking. So due to that, it may also cause asthma. Another one is physical activity. So due to the physical activities, if you are doing heavy exercise, so that also cause the asthma. So another next one is strong emotion and stress. Next one is due to respiratory infection, and another one is due to gastroesophageal reflux disease and certain medicines. So due to these all, that may irritates the airway and may have bronchial asthma present in the baby or adult. Now next slide is about pathophysiology. So let's have a look and discuss about the pathophysiology of bronchial asthma. So first, due to exposure to allergen or triggers such as dust, smoke, pollens, our immune system start to activate, which lead to inflammatory response due to the increase of immunoglobulin E, and that tend to infiltration of mucosa and epithelium with activated mast cell, T cell and eosinophils and results in bronchoconstriction. Now, mast cell that released leukotrienes, and which is also the mediator of inflammation, damages the wall of airways and cause air edema and mucus production is increased. After that, due to the secondary inflammation, bronchospasm occurs that results in hyperinflation of lungs and increase in functional residual volume. So, there is distress during breathing and lung complaints is reduced, which causes hypoxia, wheezing and dyspnea. So, these all obstructive process interference with ventilation. That means hyperventilation and hypoventilation occurs. Finally, if we cannot treat that disease earlier or if it is not corrected properly, then apnea may be developed, and finally if the apnea is not treated well, the person with asthma may die due to lack of treatment. Now, let's discuss about clinical features of bronchial asthma. So, there will be severe dyspnea, bursts of cough, wheezing, mainly expiratory. There will be sweating as well as restlessness. There will be use of excessive accessory muscle of respiration due to difficulty in breathing, as well as there will be extreme fatigue present in the baby, as well as pallor, sinuses, chest tightness, allergic reaction, schema rashes, and temporary edema. So these are the signs and symptoms which are present in the patient or in the baby due to the bronchial asthma. Now next one is about how to diagnose the asthma. So for the diagnosis, first of all, we need history taking. So history taking should be collected from the parents of the baby. So first, the child has history of allergic disorder in the family or not. There may be history of associated illness also. So complete history of the child is collected during presenting complaints. Anticipating factors, duration for which symptoms persist, etc. should be collected from the parents of the baby. Next one is physical examination. In the physical examination, we have to auscultate the chest. So, we have to find out whether there is any wheezing sound present in the baby or not, as well as respiratory rate if the baby is too breathlessness to talk or take feed, as well as use of accessory muscle of respiration. We have to check pulses, paradoxes that they may be more than 15 mm of Hg, as well as heart rate that may be more than 140 beats per minute. During acute episode, sputum and blood test, that is TC, DC, ESR should be also done, and increase eosinophils, chest X-ray. So, in the X-ray of chest shows bilateral and systematic air trapping into lungs, and also mucus plug may be seen in the chest X-ray. And another one is serum level of immunoglobulin E. So, whether it is increased or not, that also we have to identify, as well as we have to do the allergic test, and another one is pulmonary function test. So pulmonary function test is more essential for the diagnosis of bronchial asthma. Finally, with the help of pulse oximeter, we can identify whether the patient needs oxygen or not, whether the patient saturation level is maintained or not. So in this way, we can do the diagnosis of bronchial asthma. So, how to assess the severity of asthma? We can assess the severity of asthma with the help of clinical manifestation as well as with the help of scores. So, if loss of exercise tolerance capable of work, if score is yes or no. Use of accessory muscle intercostal retraction, whether it is present or absent. Another one is wheezing sound, that is present or absent. Then next one is respiratory rate, that is 25 beats per minute or not. and whether it is less than 25 or more than 25. Next one is pulse paradoxes that may be absent or present. And next one is PEEP, whether it is over 100 or under 100. And last one is pulse rate per minute, whether it is less than 120 or more than 20. So if all the scores comes, or if the score is more than 4 or 4, that suggests severe asthma. Now, next one is management of bronchial asthma. So, it can be managed with the help of medical as well as nursing management. So, let's first talk about the medical management. So, in the medical management, we can follow three things, that is fast acting drug, long term control drug, as well as other drugs. So, let's first talk about the fast acting drug. So, what is fast acting drugs? So, it is also known as quick relief or short acting. These drugs work fast to control asthma symptoms. These drugs is taken during coughing, wheezing, and having trouble breathing or having as asthmatic attack. They are also known as rescue drugs. Short acting beta adrenoreceptor agonist such as salbutamol are the first line treatment for the bronchial asthma. Salbutamol are the first line treatment for bronchial asthma, as well as salbutamol meter dose inhaler are commonly used for the treatment of attacks during the asthma. Next one is anticholinergic medications like ipratropium bromide, which gives the additional benefit to the short acting beta agonist drugs. Next one is odorless selective adrenergic agonist drugs such as inhaled epinephrine. This drug have equal efficiency to SABA drugs. But such drugs are not recommended due to concern regarding excessive cardiac stimulations. Now, let's talk about long-term control drugs. So, long-term control medications are taken daily on a long-term basis to achieve and maintain control of persistent asthma. So, for long-term prevention of symptoms, controls, reserve and keep inflammation down, reduce the need for quick relief medications. Drugs like fluticasone, propionate, meter dose inhaler are used for long-term condition. Along with that, glucocorticoids are also used for the long-term drugs. Long-acting beta adrenoreceptor, they have least effect, that is 12 hours. Let's have a look on nursing management. So in the nursing management, we have to provide emotional support and education to the baby as well as to the family. And next one is administrating adequate fluids. That means we have to give them adequate fluids. We should give them appropriate rest and comfort. Next one is we have to evaluate the respiratory status and facilitate breathing to the patient. If the patient have difficulty in breathing, so we may need to give them oxygen. So with the help of oxygen, we can maintain the breathing of the patient. Along with that, we need to suction the baby if there is secretion present in the oropharynx, which helps in clearing of the airway of the baby. We need to nebulize the baby if it is necessary, as well as we have to check frequently saturation of the baby properly. So these were the nursing management of baby with bronchial asthma. Now let's see the prevention of bronchial asthma. So first, follow the asthma plan or action plan, then get vaccinated for influenza and pneumonia, then identify and avoid asthma triggers, then monitor the breathing, then after that identify and treat asthma's attack earlier. Take the medicine as prescribed, pay attention to increasing quick relief inhaler use, maintain low humidity at home, keep indoor air clean, reduce pet dangers, and use the air conditioner. Keep dust to a minimum, clean regularly. So these were the prevention of bronchial asthma. I hope the content which I presented today was useful for you all. Thank you.